All right, I have hit record this time for this game.
Huh.
I didn't record the last
time.
I didn't.
Thank God.
I'm gonna have to find some video to replace that for the ones online.
Yeah.
What? Hey, no, come on.
Hey.
You're on a team. You're on Team Granville. David, I also have you.
I just got an urgent phone call.
Did you?
My puppy's having kittens.
You having kittens?
Puppy's having kittens. Might not make it through the day.
My gracious. Okay, puppy's having kittens.
In the microphone.
All right. What was that?
You know Granville.
Okay.
Not believing.
All right. Who would like to go first? There's one category left in this one, so not near as hard.
Let's do Coach Stroke 100.
Code Stroke 100.
Zoom,
I want to be lemon.
Okay. You'll have to remind me because I will forget. Abnormal posturing, which results in the abnormal extension of the arms with rotation of the wrists along with toes pointed. This finding indicates brain stem damage. What is it called? The separate?
True.
All righty. So your potato. All right, that was for 100. See, everybody that answers correctly, I'm nice. David. I didn't give David time.
Who's lemon?
I am. You should be celery. No, you should be pineapple. It's really quickly on the outside. Exactly. That's what I was going to say.
So did everybody agree that it was a separate?
Yes.
Okay, unilaterally. Okay. All right.
And the core word is whenever you're going in to the core. For future reference, you need to remember that.
Allison?
Oh, I'm going now.
Mhm.
Let's go conditions and diseases for 100. Chlamydia.
A progressive organic condition in which neurons in the brain die, causing dementia.
Alzheimer's.
Okay. 2, say Alzheimer's.
And
3.
that's the same as dementia?
Yeah, kind of. Yeah.
So,
The disease is Alzheimer's. You can get dementia.
Followed.
Follow it.
but in dementia, the same thing as Alzheimer's?
Alzheimer's is the beginning condition.
Dementia is the category.
Yeah.
Alzheimer's is the subcategory. There's also different classifications within that. So yes and no.
If I can't read dementia.
It's like diabetes mentalis. You've got type 1 and you've got type 2. You've got dementia, you've got Alzheimer's, and then you've got several other, like Lewy body and kind of thing.
Okay. Well, whatever.
He don't get the points because he didn't figure it out.
Okay, so
No,
all right.
I'm already in dementia.
David hasn't answered, but I'm gonna go ahead and it's gonna be broccoli. All righty.
Yes.
Allison?
Yes, sir. Let's go Code Stroke for 200.
The eye.
Yes! Corbett.
We talked about that.
For future reference,
There we go. That was funny.
did you know that was on there?
I did not.
I'm not even doing that right.
This?
Bro.
Okay, Shayna answered. She gets to pick.
Cranial nerves 100.
Cranial nerve 3 functions to move the eye, pupil, and eyelid.
I need a list.
Okay.
Can I look at a list?
Mhm.
I need to choose between answer A, B, and C.
Because I've had this little
I can't
thing
do
worked
it.
out in my head of I've remembered like certain letters that remind me of something.
David, how about you?
Give it to David if you got it. Cause I don't know.
Why do you bring all this?
It's good for your brain.
Yeah.
Makes you recall
I
stuff.
got
you
the
learn.
dementia and diarrhea.
David said, I don't know.
Okay. So we'll look it all up.
Hold on.
Shane, come on.
List. I don't want to bring up the answers. You just want a list. I just want a list.
Well, if you bring up the answers, then we might get them later.
So would you rather play a Jeopardy game or would you rather me be up here and lecture? Because that's the two options. PowerPoint, lecture, games. I try to shake it up a little bit.
It's
Whatever
the
you wanna
optic
do.
nerve.
The optic nerve. Everybody agree?
Should
No, I
be.
don't have a clue.
Yeah.
I don't
Controls
get
the
it.
eyes, the pupils and eyelids, the optic.
Yeah, I told you I just need a list in front of me, so because like I said, I've remembered some like certain letters of how I remember this.
Good.
So I got them now.
Yeah, she'll get the rest of them. Because she's looked up.
No,
All right.
I've got the names.
Oh, okay.
Doesn't have the description unless I click on it. So see, it's just a
Okay.
list.
Go coach stroke for 300.
Okay, coach stroke for 300.
Weakness on one side of the body. What is that called?
Dips.
Paralysis.
Paralysis. Okay, got deficit. We got paralysis. Anything else?
Yeah.
Who, what?
Hemiplegia.
Hemiplegia?
Mhm.
Okay.
Hemi?
Me?
David chiming in.
Oh, is he? Yay!
Hemiplegia. Okay.
Yeah.
Let's see. Hemiparesis. Good. All right. So,
Deficits are after.
Oh, well, I know that.
Woohoo!
But you're correct.
Word,
I believe
but let's just dumb it down for us dumbass hillbillies. You ain't functioning on that side.
Allison or Terry, which one?
Causes of respiratory.
Ooh.
who's broccoli and who's potato?
Broccoli's David.
Why do I
Allison?
only have 500?
Because you said, you didn't say hemiplegia.
You went with the dumbass and said
okay.
dips.
I said yes.
Causes of respiratory patterns, you said 100.
Yeah,
right?
sure.
Stimulants, exercise, excitement, lung disease, or other medical causes like anxiety, asthma, choking, COPD, heart failure, or pulmonary embolus.
What's the, I mean,
What respiratory pattern? Diane Stokes? Are we apneic? Tachypnic? Tachypnic? Okay. Tachypnia. See, this is easier than the last one, right?
well, I know, we've already had to look some up, so.
Always looking them all up.
Oh, and
All right, next.
So causes respiratory 200.
Opioids, sedatives, alcohol, pneumonia, sleep apnea, carbon monoxide exposure, and traumatic brain injury.
CNS.
Diane Stokes?
Oh, yeah, we're on respiratory.
Anybody else? We with Cheyenne Stokes. David, what about you? What do you think?
I'm gonna go with you since you went with me.
Can't pronounce it for bradynyphia.
Bradynyphia?
Yeah, it's the slow breathing. But Brady's slow and nyphia.
Okay.
I don't think that's right.
What did David answer?
Bradypena.
Bradypena.
That's what you were
There we go. I'm wrong.
That's okay.
Go wrong. We don't know you're wrong. Oh,
No, we're not wrong. We got it.
Bradypena. Woohoo. All right. So 200. 200. Who else agreed?
We all did.
You all did?
I
Okay.
didn't.
I didn't either.
I did.
Okay. We'll just leave it at that then. Next.
You gave David his points, right?
Mhm.
Does David get a pick?
David, you want to pick? Let the broccoli speak.
Who's the broccoli?
Same for 300. All right.
Bye,
Thank you.
You can come sit and play Jeopardy.
You wanna play Jeopardy with us? Oh,
Severe hypoxia, depressants, head injury, heart attack, irregular heartbeat, metabolic disorders, such as body's chemical, mineral, or acid-base imbalance, submersion, and stroke. Diane Stokes.
whatever the correct one is. My bar asked about it.
David agrees.
Oh,
Ooh. Do we need to go back and look at it?
yeah, that's a good idea. Was it the answer for the question?
Okay, maybe not.
No, that's okay. It's all right. We can move forward.
All right, who's next?
Go 400.
Pre-death pattern, brainstem injury, brain herniation syndrome. Jane Stokes.
It eventually has to be one. That's true.
Just answered on all of them.
Just start bagging them or innovate them. I mean, really, that's what we do.
There we go.
That's a shame. I can have a shame.
Okay.
I can just get this out of the way.
Sounds so excited
We
about
actually don't
it.
have another answer now.
Oh, I know this one.
Oh, look, Josh, jump, scream, holler.
I love games like that. It's possible, okay? I didn't get to do this last room. Kuzmalls. Yes, Kuzmalls.
Kuzmalls. David?
What game was it? Oh, yeah.
Yeah.
That's exactly what I'm doing. I'm laughing, it's not right. They're like, she sucks again. I'm done. I'm gonna see myself out.
You got some fire and you throwing the pants around there. It says there.
Calm down.
Today.
Yeah,
Kuzmalls.
calm down.
We got
talk about apex personality. I am. Bring it out.
F5. You know what that means?
Y'all terrible.
Right?
Yeah.
Say, oh my God, it's this.
functions of the nervous
I need you to watch the
system
Jeopardy
for
episode
one-
and you'll see why Shayna and them didn't get their stuff done.
All right, functions of the nervous system for 100. Name the part of the brain that serves for vision and storage of visual memories.
Hippocampus. Hippocampus.
Dubla.
That's a good answer though.
It is a good answer.
The frontal lobe.
Got a frontal lobe.
No, I know, I'm just trying to think of the lobes.
David?
Yeah.
Occipital. We ready?
Occipital.
I know that's one for the vision.
Occipital.
When we already went through that, the one for the vision. But I didn't know.
All right, next. David, you can pick. You got that one. Functions for 200. Name the part of the brain that senses touch, texture, storage of tactile memories. Got a frontal? David said he's drawing a blank. Are you having a stroke, David?
That was me yesterday on the damn radio.
Did you find it yet?
No, my
So hold on,
damn
so we
thing
have
is still
frontal-
spinning.
Typical side, other side, parietal, temporal. It's not temporal.
There's the medulla.
That's more for your
What it
breathing.
does.
That's
So
your
it is.
breathing, yeah.
I know the kids. I just don't. Like long-term memories?
So-
We'll just go with that because that's what nobody else is coming up with.
I'm kind of waiting on Granville here. He's struggling. I hate for him to go through all that work and
You need a millennial to do that for you?
I
Need
would
a
say
what?
yes if you asked me that. Here, you can do it way faster than me. Absolutely.
a millennial. Gotcha. Okay.
Why won't it just give me the dang? Yeah.
All right, let's just see.
Okay. All right.
Won't give me the answers.
Burrito.
All right, let's go to another one.
Nobody got that one.
Yeah.
All
Oh,
right.
now it says. Go through 100 freaking deals, they'll give it to you.
All right. Next.
The first one, 200.
I'm done.
Conditions of diseases,
Yeah.
I think.
I don't know
Yeah.
what it says, yeah.
Okay.
A temporary paralysis of the facial nerve, cranial nerve 7,
That would
What?
be
Go ahead. No.
which controls the
It
muscles
says-
on each side
Go
of the
ahead,
face.
say it, Bell's palsy.
Bell's
Bell's
palsy.
palsy.
Yes, that's, I knew that one.
And that can be long-term. It's still temporary, but it can be longer or short.
Yeah, it can go
I know
months.
people-
Can it come back?
Yeah.
Yeah.
Yes.
you go to and from.
Yes, it's only supposed to be temporary.
Bell's palsy. And what's it called
I
from?
somebody had it almost for a year.
Really?
Yeah.
What's it called from though? Cause I got a friend, she gets it quite often. She can just be goofing off.
Was it more Bell's palsy or dystonia?
Bell's palsy is what they said she had diagnosed with. But like, she'll have it for like 2 or 3 weeks and then she looks like she went and had Botox.
See, he said his sister's had it for several years.
Wow.
So
All right. Next.
300.
The slow progressive onset of disorientation, shortened attention span, and loss of cognitive function.
Mm.
Alzheimer's.
Alzheimer's.
I-
Or is it Alzheimer's or is it dementia?
It's dementia.
Dementia, because that's what he said, yeah.
Mm-hmm.
Dementia.
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 I actually remembered one.
That one.
I feel like I'm not such an idiot.
You got some points in the pineapple.
Don't be prickling me over there, sis.
All right, next.
300 for function. Unclear, don't wait.
Name the part of the brain that manages hearing, smell, language, and stores sounds and odor memories. Hippocampus. Got 2.
The what?
Oh.
David, do you agree? We got hippocampus. Terry's still out. Terry's still out with her.
I give
Well, your
up.
language.
Oh, no, or
Oh.
it's
If you're on the internet, you probably turn the internet off to get better. It'll be speedier. David says, not sure, temporal.
What I was kind of thinking.
It's gonna be temporal.
Temporal. Woohoo. All right. 1, 2, 3. Terry, what are you?
I don't know what I am.
Are you celery?
I'm not.
There's not one up there for.
That's good.
No, there is. Yeah, 1, 2, 3, 4, 5. What?
Yeah.
In the medium.
I think you're celery. Is David pineapple? Okay.
I'm the pineapple.
Yep.
David's the problem.
All right. Next.
200.
Cranial nerve functions. Cranial nerve 5 functions involve chewing, pain, temperature, touch of the mouth and face.
Yes.
Hypoglossal.
That's the,
The trophy. I don't know how you spell that.
So you got your computer up there. I'll just tell you.
Okay, that'll work. My dingbat. I said I'm a dingbat.
You are recording.
Yeah, I'm recording.
All right, so did we look it up? Did we figure it out?
I didn't look it up, I'm just guessing.
What'd you say?
Instructor word.
We'll go with that.
general?
Did David get it?
I think David answered on that one. Or maybe he did. You don't remember the cranial nerves.
That's my problem. I don't remember either.
All right, next, 300. She's a glutton for punishment. Cranial nerve 7 functions the movement of the face, tears, salivation, and taste.
Oh, it's the facial nerve.
Facial nerve?
Oh, it's just called facial? Yeah. Yeah.
She got it. Ding, 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 ding. Huh?
Did you check David?
It'll pop up.
Oh.
He didn't pop up. Yeah, he didn't pop up on that one. 400.
He's like, I don't know the nerves. I'm not gonna answer.
Cranial nerve 8 functions hearing and balance.
That's the, vestibular nerve. The vestibular cochlear. I can't say it.
Vestibular?
Rotular would
That's
be
the sh-
involving the ear.
Yeah,
So that's it.
Yeah, the cochlear.
It
Yeah,
would
it's
involve the ear.
Yeah.
I'll take it. Yeah,
Yeah,
it's the same.
thing.
It's the same.
Well, it's a lot easier to say auditory.
Yeah.
I tried to make it more simple because I know that was the big issue last time was the newer words, more advanced words. You know, you gotta change it.
500.
500? Always gotta change it. Cranial nerve 10 functions the sensation and movement of the pharynx, larynx, thorax, and GI system. Vegas?
Nerve. Yeah, Vegas nerve. Yeah, you knew the Vegas one.
Only one I know.
Woohoo! All right.
All right. 400 conditions and diseases.
A rare condition that begins as a sensation of weakness and tingling in the legs, moves to the arms and thorax, and tingling in the legs, moving to the arms. Oh, I got that in there twice. Sorry. This disorder can lead to paralysis within 2 weeks. I may have been a little bit intoxicated when I ate this last night, so
Right?
maybe just a little,
Rare condition. Why would we know rare condition?
because we run into it.
Oh, we do?
Is that the one you had? Oh.
Still don't know. Still don't know.
So it's rare.
It's
We'll
rare.
figure it out.
MS?
MS.
MS. What's your name?
David?
MS isn't rare. I mean, I don't think it is. I see it a lot.
I know a lot. I don't know. That's all I can think of.
Don't know.
Oh, I would never would have got that.
This up from time to time.
Why
Why?
would we know that?
Gillian Barr? I've run into a couple cases of it.
It's not rare.
It is rare, but
I'm just kidding. All right, go across the board. 400 for code stroke.
paralysis on one side of the body.
Go, answer.
Hemiplegia? Everybody
already
agree?
answered that one.
No, the other one was hemiplegia. I
Oh,
can't remember what the difference is.
Plegia is completely paralyzed,
Okay.
and the other one is just a sensation of a.
Oh, okay.
So we in agreement?
Well, yeah, that's the right answer. Of course, we're in agreement.
Amy. Where did I get to? All right. Next,
Across the board, 400.
OCD coming out.
Yep.
This part of the brain functions, emotions, temperature control, and interfaces with the endocrine system, also known as the dicephalon.
We did emotions.
Yeah, you said emotions.
We go with Carlos.
Frontal? David? Or like, leave me alone. It's the reason why I'm at home.
Oh wait, the temperature control. Right?
Mhm.
Is that not the no, it's the brainstem,
Brainstem?
right?
Oh, but the brainstem doesn't affect your emotions.
Oh, but it affects. Was it Uber Lagang while I'm on there?
Yeah. So who know what?
The Uganda. Well, I can't say it. Somebody fix me.
Wakanda.
That's not it either.
Padula Umuganda.
Uganda, Uganda.
That, I believe that's some good.
The only one she didn't answer hypothalamus on.
No, I was doing hippocampus earlier.
Hippocampus. Okay. All right. That's a no. All right. We're at the 500s.
All right, just pick one.
I can't.
Okay, visions and disease.
Okay, there we go. I'm Alex Trebek up here. I'm not supposed to pick. A neurologic condition in which the portion of the brain responsible for production of dopamine has been damaged or overused, resulting in tremors.
Parkinson's disease.
Is it?
Oh, it's a condition. Yeah, Parkinson's.
I like it.
To Parkinson's.
Well, isn't that when you shake all the time?
Yeah,
You,
Tremors.
tremors.
He says Parkinson's. Look at there. Woohoo.
I'm over here trying to think of what part of the brain it is. I'm on the wrong part.
Maybe we need to skip over and get that one done.
Yeah. Well, we got two left. Code.
Disorder in which the brain cells temporarily stop working because of insufficient oxygen, causing stroke-like symptoms
CIA.
that result completely within a 24-hour of onset.
Wow.
Wow.
I know
David
some things
answered.
that's normal that we talk about all the time. It's these weird definitions and stuff. I'm like,
Where did David's, where'd the chat go?
He's
There
probably
it
been
is.
answering them all along.
TIA.
I agree, TIA.
Yay.
Job.
Even though the pineapple didn't answer. He still got points. I didn't hear you answer. Did he answer?
Double Jeopardy, woohoo!
All right. Last one. Functions of the nervous system. Oh, do we want to wager?
Wager what?
Points.
Well, she's got it looked up and we don't, so. No,
No.
that was a cranial nerve, wasn't it?
Yeah.
Yep.
Let's just-
You just want to go? Okay.
Let me see the question first.
Part of the frontal lobe that performs judgment and prediction of consequences of a person's actions and abstract intellectual function. You guys know this. I know you know this. It usually doesn't develop until you're early to mid 20s.
Cortex?
Is it?
That develops in your 20s.
No. Cortex, not developed.
You got inside there. Right side is developed.
Does everybody agree? Are we looking it up? What are we doing?
You looking
I'm
at
looking
it?
up my stuff in my class. I done skipped over this one.
No, concur.
Concur?
I concur.
She is correct. All right. Woohoo.
That's not good.
But you did say X, right?
I did.
So
Yes.
there you go. It's good.
All right.
Make sure the next time I'm married again, he's over 25.
It was neck and neck. Shayna technically won. It's only by 100
Because of my
Point.
cranial nerves.
because your cranial nerves.
See, I studied that pretty hard because I needed to have a test over it. And I had to
Okay, I've married.
I had to think of something to help me remember.
Yeah.
It didn't work out.
Yep.
Oh, no.
Okay, we're gonna
Okay.
call it a break. We're gonna come back. Terry's gonna
You're gonna
teach the
keep
next
up with me.
portion. So 10 minutes, we'll see you.